Hello, REMS. This is Bryon Bass, Senior Vice President of Workforce Absence with Sedgwick. And today I'm joined with my colleague, Max Koonce. Max, would you please introduce yourself?
Thanks, Bryon. Name is Max Koonce. I'm the Chief Claims Officer for Sedgwick here in the U.S.
Great, thanks, Max. Today, Max and I have the pleasure of talking about COVID-19 and how that has impacted the claim experience overall based on what we're seeing in our own book of business across both non-occupational and the occupational space. So with that, we're going to take a few minutes to talk about some of the claims trends that we've seen in each of these areas. We're also going to talk about some of the durational information and other considerations. And then we're also going to try to get our crystal ball out a little bit and focus on some things that we believe could either increase or decrease these trends that we've seen so far. So starting on the non-occupational side, and so from a non-occupational workforce absence perspective, when we use that term at Sedgwick, that comprises short-term disability programs. It also includes any paid leave programs that are either required at the statutory level or for those that are that an employer may be offering as a benefit to their employees. It also includes unpaid leave of absence, which provides employment benefits and job protection to employees. There's a federal mandate called the FMLA, and there's also several state required statutes that employers are required to abide by. And then another area is around workplace accommodations as it relates to individuals that may have conditions that rise to the level of a disability. So that's a pretty broad, open space. And so in that regard, what we've experienced to date, and these numbers are up to date as of this week, is in the non-occupational space, we have processed on behalf of our employer clients nearly 1.7 million claims related to COVID reasons. When we break that down, we have been coding the specific reason related to COVID that an individual needs to be away from work or absence from work. And by far, the number one area is around suspicion of having COVID. So these are individuals that have symptoms related to COVID, but they don't traditionally turn out to be have a positive test result. Then the second area are those individuals who do have a positive test result. And then finally, the third is those that have been exposed and they need to quarantine because they've been around someone and thankfully they did not contract it themselves, even though they were exposed. The lowest is around school closures. So there are a lot of schools throughout the nation that have closed, and many individuals have had to take time off to be a teacher, as well as a parent, as well as an employee. And many of our employers may have offered that type of leave to individuals to take those times off. But there also were a number of statutory amendments that were made across the nation, both at the municipal and the state level, that required employers to provide this type of coverage and job protection and some form of salary replacement to those individuals. So that gives you a little bit of flavor around those particular claim trends. One other thing that I wanted to point out is because we've been tracking this and we see this information on a day-to-day basis, we've also been looking at trends. And in many regards, I felt that we had as much data at our hands even before the CDC might have received the information. And we were actually able to see trends before the CDC was reporting them out to the public. So one of the very first initial peaks that we saw was on April 6th of 2020, where in a 5-day span, we had over 16,000 claims just related to COVID come in during that period. That wasn't our highest peak, though. The highest peak came here in January 5th of 21, where over 19,000 claims were reported. And, you know, we're calling that the after effects of the Christmas gatherings and get-togethers and some things related probably, although it's in close proximity around New Year's where there may have been some gathering going on. So that gives you a little bit of a flavor of what we've been seeing from an overall non-occupational perspective. And so with that, I'll ask Max to give us perspectives on the workers' compensation side around the same types of claim trends.
Thanks, Bryon. And when you look at it from the, we'll call it just casualty and general side, is we haven't seen obviously near the number of claims that Bryon and his team have seen on the workforce absence side when you look at the 1.5 million that he was talking about. But when you look at our claims, we have seen a large number of workers' compensation claims across the country. And a lot of that is contingent on our client book. We actually have a large healthcare group. We have a large retail establishment. We have a large group of public entities. And when you look at what those claims comprise as far as the total, they represent the vast majority of the claims that we have seen in this space. From a liability standpoint, we've seen a very small number of liability claims across from our clients. And generally, that's just from the fact that it's just not a lot of activity in that at this point. Although if you read the industry publications, they're expecting it to possibly increase as the economies open up. From a standpoint of peaks, I know that Bryon talked about what they saw as far as the largest volume of claims here at the early part of this year. Our peaks came in last year. So when you look at the initial phase of, or the initial, I guess when the pandemic first came about, we saw a peak early in the spring in April. Then you also saw a peak in the summer when economies started to reopen and people were actually working to a greater degree than they had in the past. And then we also saw a peak in the November, December arena. It decreased slightly in January. And then in February, we saw a significant decrease as far as new claims coming in. When you look at the states that are most prevalent for claims, once again, this has a lot to do with the volume of clients that we have in those individual states and the makeup of those clients. We saw California representing about 26% of the total claim volume that we saw, Texas at 16%, Michigan at 7%, Florida at 4%, and Illinois at 3%. And the last thing I would point to at this time is just far as the claims themselves would be around severity. Early on in the process, we actually developed a model to try to project what category of severity the claims would fall into. And we've been very fortunate that our forecasting has actually stayed true as far as the buckets and the percentage of claims that are actually making up those buckets. And the buckets basically consisted of those claims that were what we'll call minor in nature or did not have a lot of expense associated with them. And that represents roughly 90% of the claims that we've seen come across in the workers' compensation arena. And when I talk about very low severity, I'm talking about claims that really have very minimal time off from work. You're looking at the quarantine period of maybe a week or so more, very minimal, if any, worker medical treatment that is involved in them, sometimes testing, sometimes maybe a medical visit following up with that. And that's roughly 90% of the claims. After that, when you look at the claims, you're having about 8% of what we would call moderate cases. And those involve up to 6 weeks of disability benefits and some minor medical treatment in the low thousands of dollars as far as what the spend looks like. And we're seeing about 8% in that category. And then the two severe categories, you're seeing about a 1.5% or 1.5% of the claims are severe. Now, those are claims that involve ICU treatment and an extended time away from work. And we've actually seen that can go upwards even close to 6 months away from work for the ICU treatment that is involved in that. Not necessarily 6 months in the ICU, but extensive medical nonetheless. And then we're having about a 0.5% of the claims actually involving fatalities. As noted, with 90% of the claims being in the mild or minor category, the value of those claims is fairly low. And we have those as less than probably $10,000. The more expensive categories can vacillate tremendously because of the differences in the treatment that may go in as far as ICU and the length of medical or the length of disability treatment. As to age categories, we're not seeing anything significant as far as variation in the ages, but we are seeing that, as would be expected, because it's also being seen in the public, is that those that are 60 and older have a higher level of hospitalization than our other claims, and the percent of claims involving the ICU or fatality are in the older age groups as well. Bryon, I'll kick it back to you.
Great, thanks, Max. And similarly, statistics, when we look at trends from an age perspective, they follow very much with what Max has just described, as we're seeing on the casualty side. So not a lot of variation there. And frankly, there's not a lot of variation on that from what we're seeing from the whole of the United States and even the world, that is, in terms of who's being impacted the most. What I'd like to focus on now a little bit is we're going to talk a little bit about perhaps durations from a non-occupational perspective. And again, you know, we've got these different categories in the non-occupational side. And I'm going to start with short-term disability. Now, a short-term disability claim, there are some considerations that need to be made, and that is for an individual to be eligible to receive that type of a benefit, they have to meet the definition of disability as it's defined in their company's plan. And so while we may have encouraged many of our employer clients who are self-insured to relax those requirements, given the state of COVID and the fact that we were seeing that there were some mandates for pay, the majority of our clients did do that. They did relax it so that if an individual was in fact quarantined and incapacitated because of a positive COVID diagnosis, or they were directed by their healthcare provider to isolate because they have a high risk condition, that perhaps they should consider covering that under their short-term disability plan. And so we did see that happening. Now you might think, well, if we did that, then there must be a significant amount of duration associated with those types of things, especially concerned that we also recommended that we didn't burden the healthcare system any more than it already was by requiring medical documentation to substantiate it. Instead, we recognized that we probably should try to use the honor system, and anything that goes beyond a certain period of time, which was that initial quarantine period of 14 days, then we should then seek medical substantiation on those. But that said, the average duration of a short-term disability claim was or is 20 days if it's related to a COVID-19 related situation. And with that, our average claim payment was just under $1,700 over that period of 20 days. On the leave of absence side, when we talk about unpaid leave of absence, that number went up a bit, and that's at 28 days is what we saw. Now, remember, there's other reasons that fall into this category. It's not just for the employee's own serious health condition or disability. The number that I'm giving you is referring to standalone claims, so those that don't have that short-term disability component running with it. And these are for situations where a family member may need care or they need to take time off. But remember the school closures that I talked about earlier, even though it was a small number, overall, when you're talking about 1.7 million claims, that's a large number when we get into the actual numbers. So that number is around 28 days on average overall on the unpaid leave of absence side. And then from an overall migration, as Max was talking to about the severity of claims, the way we look at severity in the non-occupational space is when individuals need to transition from a short-term disability to a long-term disability. And a long-term disability generally starts after about 6 months of being disabled. And in our book of business, what we saw were just around 300 open claims that were related to COVID-19. So we didn't see a lot of severity or a lot of people needing to move into that long-term disability category. In that book, which is great, that indicates that, you know, individuals hopefully recovered and healed within that 20 or 28 day time frame that we just spoke about. So that was something that we found to be very enlightening to us. Around the accommodation side, so this is workforce accommodations, and so around workforce accommodations overall, what we saw with our book was we had about 10,000, just over 10,000 requests for accommodations, work-related accommodations for COVID-19. And in those particular situations, over half of those were for a leave of absence. And so in the accommodation space, you generally consider an accommodation under the ADA when an individual no longer has any job protected time available to them, or they're ineligible for those protections to begin with. So we have individuals that may have fallen into that category. And then secondary, the next big bucket at 30% is environmental modifications. So when we think about environmental modifications as it relates to COVID, we're just talking about things like wearing a face shield instead of a face mask, or we're talking about putting barriers up within a work environment like plexiglass and things of that nature to prevent exposure. And then secondarily, we might have to move some individuals into an office environment where they are able to close the door and they're away from other individuals. So those are some of the types of accommodations that we were seeing throughout the course of accommodation for COVID-19. So with that, Max, I'll turn it back over to you.
Yeah, and I would just like, as I referenced already, the vast majority of these claims have a very short duration to them. Now, obviously, with the claims that are falling into what we talked about as the severe categories and fatality, those are going to linger for quite a while. But when you look at 90% of the claims or 85% of the claims, I mean, they're going to be closed down within 60 to 75 days. So they are very short duration. And that does take into consideration some of the things that we may have to think about for the future, is because some of those claims may come back or reopen. And I know, Ron, you and I talked a little bit about it earlier today, was just the long hauler aspect. Mm-hmm. And I'm sure you'll add some light onto that as far as things to watch in 2021. But some of the things that I do think are unique as a result of the pandemic and things that we'll have to kind of keep on our eye on for 2021 is the telehealth. So we saw tremendous benefit through telehealth as far as helping with the continuity of care. At one point during the pandemic, we saw it go as high as close to 20 to 21% of our total medical care was being provided through telehealth. We have seen it tail off to some degree, but what's interesting is it was about 0.5% before the pandemic. And right now we're seeing it kind of level off close to 10%. So we're still seeing a high utilization of that, especially in comparison to the past. Some of the other things that we're looking at are just things that we're trying to keep our eye on, is we did see a drop in the litigation trend. So when you look at the litigation rate for new claims or existing claims during the pandemic period, we saw that go down. So that was encouraging from the standpoint of an advocacy and pushing empathy through the way that we're approaching claims. But it's also something that we want to see if we can hold on to as far as in the casualty environment, is can we continue to have a positive impact on that? The other things that we're kind of watching are presumptions. We saw a number of states issue presumptions as far as compensability and workers' compensation. We've seen those states extend those presumptions through either legislative or emergency orders for extending the length of their emergency order for the application of it. And then secondly, we've seen some states that are actually considering presumptions. Once again, the challenge with that is that in those states that are looking at it, they're possibly making those retroactive back to March of last year, which means that those claims that have come through that were not accepted would need to be reevaluated to determine whether or not they're now compensable because of a presumption of compensability. Another thing to watch in the upcoming year is probably OSHA. We know that with change in administration, we're going to have a greater focus on OSHA than we may have had in the past. And how is that going to be impacted from the standpoint of the COVID safety precautions that need to be implemented by businesses? How far is it going to go? What are they going to expect from business from that standpoint? And also just the number of inspections that may be going out as far as from a safety aspect overall, that will obviously have some impact in the risk management area, not necessarily workers' compensation, but as far as risk management. And the last thing I would point out is just the result of what happened with the courts and state agencies as far as in the casualty world. So we saw a lot of agencies moving to some virtual aspects, courts also. But what we did see was a slowdown in the litigation process, probably most impactful in the liability arena because of the fact that you saw extensions of statute of limitations. And as a result of the slowdown, there is a significant backlog of litigated matters at this point with the courts. So seeing how we work through that and how we can actually continue to pursue resolution in those matters as opposed to waiting until courts reopen completely and they eliminate the backlog in the cases.
Great. So from a non-occupational perspective, I'll start with where Max started, and that's around telehealth. We are also seeing a significant increase in the number of telehealth visits that employees are utilizing to obtain their care and their treatment. And it's interesting because under the FMLA, in-person visits are actually a requirement in order to substantiate or to qualify it as a serious health condition. The Department of Labor, about midway through the year, basically pulled that back and said on a temporary basis, given the state of the healthcare system and the pandemic, we're going to allow telemedicine or telehealth to be utilized and satisfy the serious health requirement. And we were glad to see that. And we actually proposed to the Department of Labor that I think it's time for us, as Sedgwick, we did propose to the Department of Labor that we believe it's time for us to advance a bit to the future, and we should make this a permanent fixture with some collars. I mean, there's some things that we need to make sure that are occurring because we want to ensure that employees are receiving the appropriate care, and they have done that. So if they officially reported in early January that they have now made telehealth visits a permanent part of the serious health condition definition. So that's a good win, I think, overall for those of us that have been pushing telehealth and utilizing telehealth and telemedicine, like even in the behavioral health space, like Talkspace and Teledoc and a variety of different other mechanisms that individuals can receive care. I mean, times are changing. We need to keep up with it. So very happy to see that an agency is in agreement with that and we're moving forward. One of the things that's concerning us, and it's around long haul that Max had alluded to, and one of the things that I'm following very closely and that has concerned me a great deal is one around cognitive decline. And so what some of the studies, more and more studies are coming out from New York, from not just New York, but from Harvard and MIT and many other institutions around this cognitive decline or brain fog as it relates to individuals that have had COVID-19. And when we look at all these studies together, there's a percentage of individuals that are suffering from cognitive decline where they're having trouble with reasoning, they're having trouble with recalling memories, they're having trouble with language. There's a variety of different things that are occurring. The concern that we have is we don't know how long this is going to last. And they're calling it long hauler because, frankly, nobody knows how long it's lasting at this point. And so we believe that we're going to start seeing this, and we believe that we already have started to see this manifest in non-occupational claims, and we likely will. And we need to get ahead of this as much as we possibly can to ensure that we're aware of these types of things and that we're also there to support and recognize when these types of symptoms manifest themselves in the work environment. So to that end, our team on the workforce absence side has recently written a blog out on our Sedgwick.com website that I encourage you to go and review, and it's around this particular issue. More importantly, it's around how can your leaders have conversations with individuals that they see exhibiting certain types of behaviors, and then how do you get yourself through the process of determining whether or not they may need an accommodation or any other type of workplace accommodation that might need to be granted to them as they're going through this particular situation. The other thing that's concerning, as I've talked to more and more healthcare professionals, is that this cognitive decline will have a significant impact on individuals that already have underlying neurological conditions. So think of things like Parkinson's disease and things of that nature, which is usually prevalent in the older population. But remember, COVID-19 is also more prevalent in the older population and seems to have a bigger impact. So when you take those things combined, we're wondering if this might be the perfect storm, for lack of a better way of describing it. It would be a terrible storm, actually, for an individual that has both of these going on at the same time, and what impact that might have on an individual overall. So these long-term impairments are things that we're going to need to keep our eye on and be watchful about. And we need to also be mindful that there's stigma associated with these types of things that are occurring. Cognitive decline looks a lot like mental illness. And it's hard for people to have a conversation about it because we have such a huge stigma around mental illness and mental health. So we need to double down on our efforts to make it okay to talk about these things. So if that's one thing I could ask you to do and you get from this discussion is look at what you have in place now to encourage these conversations, and let's not let anyone out there feel like they're on an island all to themselves.
Yeah, great points, Bryon. So I think that's all I had to add. Anything else from you?
Nope, that's all I had today as well. And thank you very much for joining me today and talking the stuff that we live and breathe every day. And we're glad to be able to share with the rest of the RIMS attendees. And we hope you got some beneficial information out of this session. So thank you very much.
Thank you, everyone.